Down a bit.
All right, good morning, everyone.
Hello.
Oh, everyone's happy today. That's good to see. Well, good morning, Queensland, and apologies for being a little bit late this morning, and I can assure everyone we'll be back to 10 o'clock tomorrow morning. So didn't want to disrupt everyone's day today. Okay, so we're here today at the famous Brecky Creek Hotel, but we have some good news for Queenslanders, and I really want to thank everybody for doing the right thing. And today we have 0 community cases in Queensland. So well done, Queensland, fantastic job. We do have 4 overseas acquired, 1 is detected in hotel quarantine, and 3 are in from an LNG tanker, the Pan Europe. So we saw some cases in relation to that one earlier. So we now have 97 active cases. We still have 2,444 people in home quarantine at the moment. So thank you for those people that are doing the right thing there. 15,000 tests yesterday. So again, really good. Remember, if you are sick, any symptoms whatsoever, please go and get tested. And yesterday, 18,114 vaccines were administered by Queensland Health. And don't forget that the Commonwealth is responsible for 70% of the vaccines and Queensland Health is responsible for 30%. Okay, so we are still waiting for that extra Pfizer from the federal government. As soon as we get that, we'll be able to expand those doses that are being given out in Logan and in Caboolture, so we're looking forward to that. In some good news, Goondiwindi is now up to 70% vaccination, so we're getting out across those border communities to make sure that their vaccinations are happening. And we have over 100,000 that have registered on our list to get the Pfizer. I want to see more people registered. You have to be on that list so we can get you vaccinated. So when we get that extra supply, we will be able to do that. So please sign up and put your name down. Okay, well, everything we have been doing, and Queenslanders have done a mighty job. So today I can actually announce that we will be easing some of our restrictions. Remember how we were looking at Sunday at 4 p.m. The good news is we're bringing that forward to Friday 4 p.m. So I'd like to go through that with you so everyone can understand what that means. So from 4 p.m. Friday, you can have 30 people to your home and in public places. The weddings and funerals will go up to 100. There'll be 75 capacity for indoor events and stadiums. And in good news for our community sport, Dr. Young has said that community sport can come back this Saturday. So that's wonderful news. Okay, so in relation to the square metres and everything for our cafes and restaurants and everything, we are going to keep these restrictions in place for another week, and we'll review it at the end of the week if we continue to get those 0 cases. So it's all contingent on what happens over the next week, but hopefully in a week's time we'll be able to stand here before you and say that there's going to be more capacity in our cafes and our restaurants and pubs. So we're asking Queenslanders to please be patient for 1 more week. Okay, so in Cairns and Yarrabah, they'll go back to the restrictions for the rest of Queensland, but it's the 11 LGAs and SEQ where these restrictions for that additional week will apply. And that's because of what's happening across our border in New South Wales. It is a real and present threat to Queensland. So we are monitoring it incredibly closely, and I'll talk to you about the border issues in 1 moment. But I want to talk to you about masks. We know how important these masks are. So what we've been able to, on the advice of Dr. Young, over the next week, if you are outdoors, you do not have to wear your mask, but you will have to continue to wear your mask indoors. So that is, you're going into supermarkets, you're going into shopping centres, you're going into workplaces. High school students will continue to wear the masks. So this is really important. This is our added protection against the Delta variant, and I think it's a small price to pay for some easing of our restrictions. Okay, so now I want to, and you have to carry your mask on you at all times as well. So if you're out and about, walking around, walking the kids to school, walking your dog, going out with friends for a walk, you still have to carry your mask on you. So it's pretty basic stuff, and Queenslanders have done an excellent job. Now the borders. Okay, what we have seen today is a massive escalation of cases in New South Wales, and we do wish the people of New South Wales all the very best. This Delta variant is of concern. So we are concerned, and I'm quite sure that the rest of Australia is concerned as well. So that means we've strengthened our border, we've got extra police down there, and I please ask people to be polite to our police officers. There is no reason to be angry, because at the moment there are stay-at-home orders in New South Wales. So if you live in New South Wales, you should be staying at home unless you are an essential worker. Now, we are going to go through even tighter restrictions on essential workers. So we've tasked the job this morning with the Director General and Chief Health Officer to go through and look at those classifications, because at the moment there are too many people crossing the border. So that means we want to put even tighter restrictions on our border. It only takes one person crossing the border with Delta and we're into a lockdown. Now, I don't want that, and I know Queenslanders don't want that. And that's why we have to have these restrictions for the southeast for the next week. So we'll be tightening up even more that New South Wales-Queensland border. And I'll get Dr. Young and the Deputy Commissioner to talk a little bit more about that. So can I thank everyone for all the great work that they have been doing. So some good news today, those easing of restrictions on Friday at 4 p.m. Good for community sport, but just remember, make sure that you have your mask on you at all times, and if you're indoors, you must have the mask, as well as on public transport as well. So thank you very much, Queensland. Keep up the mighty effort, and I'll hand over to Dr. Young.
Thank you, Premier. So yes, excellent news. No further cases in either our Indooroopilly cluster or our Cairns cluster, which means that we can go and remove some of those restrictions and have some more ability to have that freedom in our everyday lives. And that will start 4 p.m. on Friday. But because of what is going on down in New South Wales, today they announced another 633 cases, which is extraordinarily sad and very, very difficult for them. We do need to maintain some restrictions for a further week while we tighten up our border. So we already have that requirement that any of those very few essential workers who are going to be able to cross the border must have had at least one dose of vaccine by Friday. We already have that in place, but we're now going through just to make sure that every single person coming across that border is genuinely necessary to the functioning of Queensland, because the New South Wales Premier has put in place stay-at-home requirements for everyone living in New South Wales. That's how concerned she is and her government is about what is going on in New South Wales. So, of course, we are just as concerned that we can see the cases moving closer and closer to our border. We've seen cases in Broken Hill, in Bourke, in Dubbo, in Walgett, in Yamba, in Ballina, in Byron Bay. We're just seeing them coming closer. So we have the next few days to really get that tightened up and sorted so that we minimise movement. Now, anyone who lives in Queensland, I put to you whether or not you should be crossing that border. Really, really think very, very carefully before you decide to cross that border down into New South Wales, because New South Wales is finding positive sewage, positive with COVID, before they're finding the cases. So it is a real concern. There is a delay in New South Wales finding cases. So you could cross that border into an area you think is okay, and there'll be COVID there, and then you can bring it back to your family, your friends, your colleagues, your community here in Queensland. So people here should not be crossing the border into New South Wales unless you absolutely cannot help it. And similarly, people from New South Wales shouldn't be crossing into Queensland. That's critical. We are seeing Delta now cause problems throughout the country. So, as you know, we now have restrictions on people coming from Darwin and Katherine. If they're coming into Queensland, they have to quarantine from anywhere in Victoria, anywhere in New South Wales. And yesterday you would have seen that New Zealand had their first case, and it's now been confirmed as Delta. They had their first case in their community in over 6 months, and they've had more cases this morning. So as of 1 a.m. tomorrow morning, anyone coming from New Zealand will have to go into hotel quarantine. So those green flights have been suspended. And the Commonwealth, of course, is working through what they're doing with the rest of, with the whole country. But at this point, Queensland, anyone coming from New Zealand, anywhere in New Zealand after 1 a.m. tomorrow will also be going into hotel quarantine. So we can just see that one case of Delta can rapidly escalate. We're seeing that time and time again. So it is absolutely critical. We've got to find the first case. Even finding the first case, we probably have to lock down immediately. We've seen that experience everywhere. But if we don't find the first case, we won't be locking down for 1 or 2 weeks. We'll be locking down for months. So please try not to get infected. And at the moment, the biggest risk to Queensland is that northern part of New South Wales. So please do your best not to get infected. And if you do get any symptoms anywhere in Queensland, doesn't matter where you are, please come forward immediately and get tested. Our turnaround times here in Queensland are less than 24 hours. The only turnaround times that might be longer are those people that are collecting specimens in Queensland and sending them to laboratories in Sydney. As you can imagine, the turnaround in time in Sydney, because they're doing up to 150,000 tests a day, is blowing out. So if you're concerned and you don't want to stay at home while you wait for that negative result, which absolutely has to happen, you might like to check the turnaround time of the place that you're getting tested at, because that's really important. Once you get tested, you must wait at home in isolation until you get a negative result, unless you're that group that we're doing surveillance testing on, you know, air crew, freight workers, hospital workers, quarantine workers. For other people, you must stay at home till you get a negative result. And Queenslanders have done that time and time again. Thank you very much.
Well, Queenslanders have achieved something quite incredible in containing the Indooroopilly Delta outbreak. I don't know of anywhere else in the world that have succeeded in this way, and as a reward for our efforts, we're now able to ease some restrictions, bringing forward the easing that was planned for Sunday at 4 p.m. to Friday at 4 p.m, and also confirming that if we can keep our border safe for 1 more week, there will be additional easing of restrictions 4 p.m. next Friday. We need to prove over that week that we can contain the Delta virus south of the border, that we can keep our border strong. And if we can do that, then we'll be able to return to a bit more normality here in Queensland. What we're saying to folk who might have saved up some coins during lockdown is now's a great time to get out and support our hospitality industry. This weekend or even Friday night, book a table at a local restaurant, a pub, a club, a cafe. Get out and have a steak, maybe a beer or two, and support our hospitality businesses. We know they've been doing it tough. I know a lot of people have also been missing their community sport, and it's fantastic to let particularly kids get back out on the field. For me, that means this weekend will be spent watching Sam and Bridie play soccer and Aiden play his junior rugby league, and I can't wait to be there.
I want to just say thank you to all of the vaccination teams working with the Queensland Police Service down on the border. We are mandating that anyone who is an essential border worker from 1 a.m. on Sunday morning will have to have at least one vaccine. And they've been working amazingly across all of our local government areas right along the border to ensure that this is mandated, but also that we have the capacity. So there's people already coming in getting vaccinated. They started yesterday. And I wanted to just let people know that at Broadbeach, we will have extra capacity. We will be open till 6:30 each day, and we will not turn away anyone who is an essential border worker there to get vaccinated. In fact, our amazing staff have said they are not leaving that centre while someone's standing there waiting to get vaccinated who is an essential border worker this afternoon. So I thank them for that. Queensland Police were able, because they're intercepting every vehicle crossing the border, we were able to start doing an audit yesterday of how many people are vaccinated, and we're seeing about 50% of people are already vaccinated. And in fact, it's Queensland Health that has vaccinated around 16,000 New South Wales residents in that border zone already, leading up to this latest restrictions. We also have walk-ins at Ipswich and Logan Entertainment Centre for essential border workers, and we have capacity and clinics starting up at Bailey, Henderson and Toowoomba. Inglewood will have a clinic open from tomorrow. Texas and Goondiwindi will have clinics open from tomorrow and on Friday as well. If you need any information, call 134 COVID or look up the local health information. I want to thank all the general practitioners and community pharmacists in those regional towns as well who are working with us. In fact, I just found out this morning that community pharmacies have delivered nearly 30,000 vaccinations already in Queensland. So thank you to our pharmacies working hand in hand with the government. It's important we have these restrictions still at the lower level for the next week after 4 p.m. on Friday. Please look at the Queensland COVID website and the roadmap to see what those restrictions are. But it's wonderful that you'll be able to have more people in the household, more people at weddings and funerals. We will have community sport happening again, more people at allocated seated events, including stadiums, and of course, less requirement for masks outdoors, but you must have the mask on you at all times, so if you can't social distance, you are wearing them. And of course, any indoor area, shopping centres, other places you're going, workplaces where you can't social distance, you are expected to wear those masks. This is that added dimension that we know makes a difference and to keep everyone safe. Why are we doing this? Why is it so important? It's 63 days today since New South Wales recorded their first case on the 16th of June. They've had almost 9,000 positive cases linked to that one cluster, and sadly 60 deaths in 63 days. That's a death almost every day now. We cannot take the risk. The risk is increasing as we see infections coming up the New South Wales coastline and their regional towns. We know Queensland will do the right thing. We do this together, we work together. Please, if you are an essential border worker, you need to get that vaccine. For everyone else, please register on the Queensland COVID website if you aren't planning on going to a community pharmacy or a GP. If you are 16 to 59 years old, we have added capacity now. We have over just 108,000 people registered. That's just over 1 week's bookings of vaccinations. So we want to see a lot more people registering to get Pfizer. And if you're not on it, you can't get it. So get onto the register so we can book you in and get you vaccinated as quickly as possible. And can I also give a shout out to all of the health workers, public health units, to our compliance and enforcement and exemption teams, and also our directives team. They don't get a mention much, but these people do incredible work. We're changing the directives regularly. These are very important documents, and I want to give a shout out to the Queensland Police Service and the health workforce who are working on those directives as well. And thank you for the great work you do.
Good morning. I'll come back to our borders shortly, but could I just firstly say that we are seeing very high levels of compliance in our community. So in the last 24 hours, only 5 on-the-spot fines, 2 for borders, 2 for people not wearing masks, and 1 gentleman who wouldn't follow the direction of a police officer when asked to do a QR code. So no arrests. We handed out 68 masks, so the message is still there for people. The masks are not going away. You really need to carry them and wear them when you should. And our businesses, very, very good levels of compliance, 115 checked and no issues whatsoever. Coming back to the borders, we are seeing a decrease over the last day or two of vehicles coming across the border. So from a high of 7,700 on Monday down to 5,700 yesterday. And we saw the turnarounds go from 1,090 down to 513 yesterday. So that shows us that people are starting to understand what's required of them. And also we've seen the reduction in time delays on both the M1 and Gold Coast Highway that are the most problematic crossings. With the changes that are coming, can I just reinforce to the community, and particularly those people that live in that cross-border zone, we are not going to stop the very rigid application of the Chief Health Officer's directions. So there will continue with that 100% checking of people that come across the border. So as of later this week, when the direction comes in around the vaccination, people need to make sure that when they get their new cross-border pass, that they accurately reflect in that process that they have been vaccinated. We're working towards the pass being able to capture that so that people can fill that out, and when they are issued the pass, it's on the basis of the fact that they have been vaccinated. We will then, in our checks, verify that where we need to. Now, the types of things that people can do, it's a very simple process. I did it myself yesterday. It takes virtually a couple of minutes. Download through your MyGov site from Medicare the certificate that can go onto your Apple Wallet or similar on your Android phone of your certification of your vaccination. Or if you've been to the doctor, the little vaccination card, or the pharmacy, that little card, or even something from your doctor. But there will be other advice that will come out through Queensland Health on their website, and if you're not sure, you can always ask on the helpline. So just be bearing in mind that rigid application means that we are no longer taking an educative approach when it comes to our borders. Yes, we will show compassion in terms of whether we take enforcement action or not, but if you get to that border and you cannot satisfy the conditions to enter, you will not be entering. Now, we're hearing lots of sad stories around how this impacts on people. I'm terribly sorry about that. We are going to continue to do that. You must meet the requirements to enter the state, or you're simply not entering. So we will try to work through, we'll keep the messaging going. So the best thing we can do is see that turnaround number keep dropping down from 500 to virtually no one's getting turned around, so that we can keep people coming through. Thank you.
How many essential workers are coming across the border every day at the moment?
Look, at the moment, that's the predominant number. So yesterday we saw actual cars, 3,885. The rest of the figure, that was heavy vehicles. So that tells you in that there's usually about anything up to 500 people on top of that. So we're seeing around 4,000 or a bit more people coming across the border. Most of them are against that essential worker pass at the moment.
And how many do you want to see that reduced to?
I want to see the smallest number possible of people moving across the border. I mean, there are services in New South Wales, of course there are. There are some services that aren't, so people might have to come across for those, but wherever possible, where people have an option that they don't need to cross the border, they need to take that option.
Dr. Young, what you said you're going to contract the list, the Premier said what people will no longer be considered essential, obviously.
Yeah. So I've asked the Director General of the Premier's Department to work with all of the Director Generals so that they go through all of the people who may need to cross and work out, are they absolutely essential? They understand them. So for agriculture, for telecommunications, for all of those areas, for health. So my own Director General, Dr. Wakefield, is going through it for health. So they are the people who understand what is so critical that those people still need to come into Queensland.
So we can't tell people today, like in the next few days, you'll be able to clarify that.
Yes. Yeah, but people need to, if they are deemed as being critically essential, they will have to be vaccinated. So they need to organise that vaccination now.
Dr. Young, Tony Morris, QC, I don't know if you see the article, but raised concerns about people not getting the correct letters. Are you worried about that? I mean, everyone did the right thing.
Of course. Yeah. So we only gave our directions to the person we were worried about, and then we asked that everyone else in that household remain in quarantine, and they did. They were absolutely brilliant. And can I say, that's why things work in Queensland, People don't need the absolute letter of the law to do the right thing, and they've done it time and time again. So when I said to people, please don't go outside your front door unless it is absolutely essential, people didn't go outside their front door. Yes, there were loopholes that they could have gone outside their front door to go and do some shopping, but did they really need to do it? And only individuals can work that through. It's only an individual that can determine that something is essential. Maybe buying a heater is essential for one person, but for another person, they can wait. So that's why I think time and time again, we've managed things in Queensland, because people have gone beyond what the law actually said.
And is that the process you'll continue then? Just
Yeah.
send us to the high-risk member?
Yeah. Well, we couldn't. I can tell you, it was over 19,000 people we had on one day, 19,593 people. We didn't have the facility to go and serve an order on all 19,593 people. So we rang them. The Director Generals are going through all of them at the moment. So at the moment people do have passes, and that's why I asked the Premier, could we keep in place those restrictions for a further week to give us the time to get the border as tight as we can possibly get it. Yes. Yep, that's what we're seeing time and time again. We saw that in the Northern Territory. Yesterday we saw that in New Zealand. We've seen it in Victoria. One case of Delta means we need a lockdown.
Dr. Young, so with that list...
Can I clarify that? Till we get 70% of our population vaccinated. So the sooner we can get people vaccinated, the sooner we can stop that requirement for a lockdown.
With those essential workers, obviously, the DGs know who they actually are personally. Is that the extent they'll be going through literally with that 4,000 a day, looking at individuals and saying, no, you don't need to?
They'll get one exemption, and unless things change yet again, that will stand. So they won't have to require a new exemption every single day. They'll be deemed as essential.
Or deemed non-essential, as you try.
Or non-essential, exactly.
Ideally, would you like to get it down to half, like 6,000 to 2,000?
I'd like to get it down to zero. I'll be blunt. I do not want the risk of Delta coming into Queensland, but there are some areas, of course, we don't have those particular skill sets and we need them. There's no one in Queensland who can fulfil that role, well then we're going to have to let those people in.
Dr. Young, do you think that all state public servants should have the vaccine mandated? Do you think it should be mandatory for all public servants, the vaccine?
I believe that if people want to have freedoms to be able to go about their lives, they need to be vaccinated, because the only other way of dealing with this is requiring people to stay home. And I'm sure no one wants that. And that's where we're heading. So with the Delta variant, which is so infectious, and unfortunately we're seeing it's younger people who are getting sick and it's younger people who are dying from it, but that's because they're the ones who aren't vaccinated. So we need to get people vaccinated, and then people will be able to go about their lives. Otherwise, I can see in the future that the people who aren't vaccinated are going to have to minimise their lives to protect their own health and safety. So vaccination is so important. There are a very small number of people who, for medical reasons, can't be vaccinated. It is minuscule. But for the vast, vast majority, they really need to think about why wouldn't they get vaccinated.
For those people who don't want to get vaccinated, there's still a level of vaccine hesitancy around Australia. How do we get them vaccinated? Do we have to mandate it?
Well, I hope they're hearing the message that the only way we can get back to any semblance of normality is to be vaccinated. And we're very, very fortunate that the world scientists developed these vaccines so quickly, and they're very, very effective vaccines. They're not totally 100% at stopping spread. We know that. We've seen quite a few examples of that, but they are almost 100% effective at stopping most people from dying.
And one more real question with mask wearing. You had to wear a mask when you're visiting a friend. Are you supposed to do that? Masks indoors?
You don't need to wear masks in someone's private house, but most other places, unless you're outdoors or you're indoors and you can socially distance, So you're in a workplace in your own office or in an area where all the desks are spread out. Otherwise, yes, you must wear masks everywhere, but not in your own residence.
So the hotel, for example, Dr. Young, that's a good example, so you can still sit down and take your mask
Oh
off.
yes, of
But
course you can
when
take your
when you're walking around, you
Yeah.
have to wear it
Yeah,
inside.
when you're going off to the bathroom or you're moving around, once you stand up, you put your mask back on. But when you're seated, eating, drinking, of course, you don't need to wear a
Or
mask.
if you go to a friend's house, you don't have to wear it.
No, if you're in your own private residence and you've got visitors in that private residence, you don't need to wear a mask. That's the law. If you wish to do more than that, if you had vulnerable people there and you make decisions, of course make decisions. But there is no requirement if you're in your own home, with or without visitors, that you need to wear a mask.
Every state and territory at some point has flagged issues with supply from the Commonwealth. Why
Yep.
is Queensland lagging with its vaccination rate?
I don't think we are lagging at all. Everybody is roughly the same point, and if we have more supply, we can vaccinate more of our population. We know that. We've got 100,000 people essentially on a waiting list to be vaccinated.
So you're not anticipating Queensland to come in last ahead of Christmas when everyone across the country?
No, not at all.
And
So the new vaccination hub is south. That is
Sorry?
The new vaccination hub is south, and that is all
The entertainment centre, yeah, it's still going well.
still
Yeah,
getting looked at.
Yeah,
every
yeah,
day.
yeah.
So by definition, by logic, you'll be able to open up another one to get it.
We're looking at opening up more capacity at Logan and Caboolture, and as soon as we get that additional 100,000 from the federal government. So it's come in, it's probably getting tested, and then we can get it out to people.
Are you expecting to extend, when that wasn't announced the other week, there was a date saying it was scheduled to be open until October 9. Will that be extended at all? Why was that?
Sorry,
The convention centre vaccination hub, the press release when it was announced. had
I'll have to
October
check
9.
that, but the entertainment centre's open. Yeah.
What's your view about employers allowing people to get vaccines on work time? We've had calls in this morning, people being told they've been called by the hub, to not waste any vaccines and not being allowed.
I think all employers should do the right thing, and I know we do it from a state government perspective as well. If you are due to go and have your vaccination, please let the person go and get the vaccination, because it's actually keeping people safe. So as a community, we need to do that.
We've got people having their pay docked or just told they can't go off shift. I mean, is that fair?
Well, I think employers should do the right thing here, because we need our community vaccinated.
Is your government going to offer 2 extra days, extra additional?
No, we're not, because we're allowing people to go and get vaccinated, and they can take that time off to go and do that, just as everyone else has taken the time to go and get it.
Does anyone for the health service?
Sorry? Sorry, if... I'll check with Steve. They should be, because they're front line. So we'll double check that, but I'm pretty sure they are. Otherwise they wouldn't be there. Is my understanding. Yeah, they are. Yes.
Do you know whether Queensland's still stockpiling vaccines for second doses?
No. Okay, so we need everyone to go and get vaccinated, and if you have any symptoms, to go and get tested. But can I just thank Queenslanders for doing a great job? Also too, a lot of people have been asking about whether or not they can move around other parts of Queensland. So from 4 p.m. this Friday, they are free to move to other parts of Queensland as well. So that's going to be welcome news. But just remember, in those 11 LGAs in the southeast, to please do the right thing, carry your mask and stay safe, Queensland.